Hi, I'm Dr. Mike, and in this episode of Health Thyself, we're going to be talking about muscle testing. So, muscle testing is the use of testing the muscles of the body to get an idea of what's going on more in the internal workings of the body. You can test for neurological function to see how well the nervous system, the brain, spinal cord, and the nerves that come out of the spinal cord are working. But you can also use muscle testing for other things, nutritional needs. You can test alarm points on the body to see how the organs are functioning, and you can use it for accessing what I call the innate function of the body, which is the function that's running the body. So we'll be showing you some videos with some examples of how muscle testing works and introduce you to the idea of kinesiology and its applications. So stay tuned. All right, so we're going to go through some of the basics of muscle testing, show you a little bit about how muscle testing works and some of the different things that you can use for it. First thing we're going to do is go through some of the larger muscle groups, more from testing neurological stability. So first thing I'm going to do is test the biceps muscle. So we're going to have you make a fist here, and I'm going to pull. And muscles are generally graded from 1 to 5, with 0 being no strength at all, to 5 being the maximum. So when somebody is nice and strong and they're locking in like this, that would be a 5. So we call that a 5 biceps. Next thing we're going to do is you're going to make a fist here and you're going to resist me, and I'm going to push. This is the tricep muscle. And again, that would be rated as a 5 because we have full strength there. And then usually for a balance, we're going to be checking both sides. So you're going to push against me, good. And same thing here. And again, that's strong biceps at a 5. This is the deltoid muscle. And we're going to be pushing down right against me, and that's a good 5 as well. Each muscle is innervated by a different part of the spine. So when we're using kinesiology in this way, we're actually checking the integrity of the nerves, the spinal cord, and how well the brain is working. So you're going to hold your arm up. I'm going to try to push. And again, that's a deltoid. Try to hold. Good. So if we're going to check the trapezius muscle, and we can go through different muscle groups this way, we would have the person shrug their shoulders. So you're going to bring your shoulder up. I'm going to try to push down. And again, do the same thing here. Good. And those are both good. And then if we were going to check the lateral neck flexors, which would be the SCM muscles as well as the levator muscles, we'd be pushing against the head. You're going to resist. Good. And then you're going to go this way. And this is kinesiology being utilized for testing neurological as well as muscle strength. Now, kinesiology can also be used as what's called applied kinesiology, which is using kinesiology to access different workings of the body, meridians as far as acupuncture goes, alarm points which can give you a sense of whether an organ is in trouble or not. And the way that I utilize that is using what we call O-ring testing, which is a lot more sensitive. So with O-ring testing, we take the thumb and the pinky, which are basically the thenar muscles, and what we're going to try to do is we're going to try to pull them apart. And generally, when a patient is first learning that, I usually will tell them to hold. Now, my Lisa's been doing this quite a long time, so she knows as I pull, she resists. And what you're looking to see and feel is whether you're getting a good lock, which means the muscles are locking together. And same thing, and you can use any of these small thenar muscles. This is called O-ring testing. A lot more sensitive than using the large muscle groups, and we can use O-ring testing more for an applied kinesiology. So let's show a couple examples of how we would use O-ring testing more as an application of kinesiology known as applied kinesiology. So what we're going to do is we're going to get a good test, and we know we have a good strong test, and we're going to have her turn her head to the right. So this is accessing the top vertebrae in the neck, called the first cervical of the atlas, and then we're going to pull on the fingers and see if that's holding. She's got a nice good hold there. That tells me when she rotates her atlas, we're getting good neurological signals down the arm into the hand. So you're going to turn your head this way, and that's fine too. So we know that the atlas, when we're rotating it, is intact as far as the positioning. And that's how I'm using now kinesiology for assessing how well the spine works. So we can go through different vertebrae this way. We're going to check her fifth cervical in her neck. You're going to tuck your chin all the way down. So she's going to put her head in flexion. Now we're going to hold the fingers. And notice now she cannot hold her fingers together with her head flexed. So that tells me we have a problem with the fifth cervical. And from a chiropractic point of view, when this test shows a positive, it means that fifth cervical has moved out of its normal positioning. So again, when she tucks her head down, all the way down, we have weakness in the fingers. So again, we're looking at a fifth cervical problem. Now, if we want to check another vertebral segment like the thoracics, we're going to have her shrug her right shoulder. That moves the first thoracic. And again, we're having weakness. So shrug this one, and that one is nice and strong. So we're going back to this one again, and that's weak. So now we know from a kinesiology or an applied kinesiology point of view that we have an issue with that first thoracic vertebrae, T1, and we have an issue with the fifth cervical. We can actually go through with this and check her cranial nerves too. So we're going to have her challenge her cranial nerves by placing her tongue in her right cheek, and nice and strong with that, and tongue to the left cheek, nice and strong, and she's going to put her tongue right on the roof of her mouth, and nice and strong. So that tells me that the cranial nerves that control the tongue and the occipital part of the brain are all working well. Now we can also do spot testing, and what spot testing is where we take the hand and we place it on certain reflexes in the body. So for instance, we want to spot test the alarm point, which is an acupuncture point for the lungs. We would have her press here, and then we test, and we have a nice strong test there. The other lung is good. If we wanted to check the bronchioles, we press in the middle, and the lower bronchiole, we press there. So we can actually go through the different organ alarm points, press on those alarm points, which are surface acupuncture points, and then use the kinesiology as well for testing whether those points are working. That gives us an idea as to the different organs in the body. Another one would be the pancreas, which is right up underneath here. And we have a nice strong test here, and we can scan the organs this way. That's the spleen, and then if we go through the gallbladder, which is right up underneath here and right back here. These alarm points are kind of like check engine points. They don't really tell you what is wrong or what's going on with the organ, but it does tell you to look at that and maybe do more diagnostic testing or possibly do blood work or imaging or whatever you need to do, because it doesn't tell you that there's a specific dysfunction. It just says check the organ. We can also go through and check different extremities with this testing as well. So if we wanted to test, let's say we wanted to test the medial meniscus of her knee, we would have her touch down here on her knee, and then that's a alarm point check for the medial meniscus, nice and strong. If we check her lateral meniscus, that's nice and strong too. So again, this is using muscle testing or kinesiology for an application for checking either a vertebrae, an organ. We can also use it for nutritional testing. We can use it for allergy testing. There's a lot of different applications to that, making it very useful. So again, with O-ring testing, we're holding the fingers, could be any finger. I like to use the pinky and the thumb because it's the most sensitive. We're trying to pull those apart and checking to see whether or not we have a nice strong pull. And then we're challenging it either with a touch on the body or with a certain movement to see how her nervous system responds to that. Now, interestingly, we can also check brain and cognitive functions with her as well. So let's say we wanted to check how well number processing works with her body. So I'm going to have you count from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8.
And you can try to hold your fingers, and that's pretty good. Now we're going to have you count from 10 to 1.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
And again, hold, and she has a nice strong hold there. So if we're having an issue with either some type of dyslexia, possibly post-concussion, or symptoms involving central nervous system processing, we can also use that by having patients recite certain things, count, say the alphabet, things like that, and then we do a muscle test to see how well her nervous system and body is responding. So This particular test is actually plugging into her spinal cord, brain, and nervous system. So it's almost like plugging in a telephone line where we're connecting with the nervous system and then certainly asking it certain questions to see how well it responds to that. So that's an application of what's called applied kinesiology. We'll talk about that a little more when we talk about the different ways that we can use that for testing how well the body is working in real time. Viewing of this video podcast is for general information only. It does not constitute the practice of medicine, chiropractic, or any other healthcare services, including the giving of medical advice. No doctor-patient relationship is formed or implied. Please subscribe, like, and share if you find these podcasts useful. Thank you.